was off. Hold on just a sec. Okay. All right. So our goal today, I've been saying this all semester so far, is to go deeper into what are the facilitation groups. So far in this class, we've introduced the idea of helping. We presented a general model. We provided a few theories that have been used to guide the therapeutic process. And then we went through and looked at how groups are developed, the most kind of basic structure of how groups move from the beginning of introducing, getting to know, and then really getting into the cohesive mark, and then getting into action phase, and then resolution phase when it's nearing the end of the group process, and how to kind of determine where you are at each level. Throughout this semester so far, we've talked about things like, and later on, when we go more in depth in this, we will explain this a little bit more based on this group dynamic or conflict or things that arise during each phase of the group developmental process. This is that those lectures of more and more depth. Okay. But to start, let's start with a general kind of idea of what is facilitation skills. Okay, we use facilitation skills to guide and direct key parts of our work. Okay, especially in the group process. You will notice that in most groups, we don't use the term psychotherapist or counselor or any of those terms that denote that you're there to analyze everyone and provide some deep, meaningful connection that then leads to some therapeutic outcome. In groups, we often use the term facilitator, okay? Because our main goal, while we do have therapeutic ideas in mind, is really to really make sure the group is meeting their goals by, again, using this term facilitate to guide or direct the group towards some type of action, okay, and some type of skill development, coping mechanisms, understanding of their condition. But really, what you're wanting to do is the group to become kind of the psychotherapists for each other. And there's three principles of facilitation. Okay. One, our goal is to draw out the opinions and ideas of others, to encourage interaction, to make sure that everybody has a voice, and to focus on the how and the what. Okay. Um, so we usually talk about the how and the what when we're looking at psychoeducational groups and therapy groups. Okay. After individuals have gone through those two types of groups, they can go into what's known as a process group, where they can analyze closer the why. But for the most part, most groups should focus on the how and what. And the reason being is because in the group setting, we usually only have people for a very, very limited amount of time. And we have all more than just one individual there. We have a group. Okay. And so focusing on the whys of the world can really limit your ability to really help your group discover skills, discover coping mechanisms to practice those. Also, current research on therapy effectiveness actually suggests that you do more good for your client is if you focus on the how and what right now, meaning that you focus on the symptoms, if we're going to put it kind of in medical clinical terms, you focus on the symptoms and how they're experienced right here, right now, and work on alleviating those symptoms or that person's issues in the current time. Okay. Because what that has shown is to be more effective as a treatment than going back into a person's childhood and adolescence and trying to figure out when this started, when it began, and how it was developed over time. Therapies that focus on that why component tend to be less effective than those treatments that focus on the how and what today. Indeed, some research suggests that if you focus on today, the how and what today, that really individuals naturally through our memory system and how our memory system works will realign those why memories to make sense in the person's current therapeutic position. Okay, so meaning that they may not need to go back to their childhood or adolescence or young adulthood to figure that out. The memory system will make sense of it in the newly developed individual who is coping with their symptoms and their issues today. Okay, so kind of some interesting ideas on why we should focus on the how and what, especially in the group setting, and then never take sides. And we've talked a little bit about things like this when we talked about attractiveness, when we talked about, yeah, group members that emerge as natural leaders. And we talked about the dark side of it when you have individuals who are there for nefarious reasons, such as someone who has psychopathology. And it's easy to get into the grasp of someone who is charismatic, attractive, and all of those things, and allow them to have more of the stage. But our goal as facilitators is to make sure we understand our own biases, our own idiosyncratic preferences, and to set those aside so that everybody has the chance to uh, have the pedestal, as you would say, the soapbox, and they're all heard, and that sides are not something that we say, well, Bill, I think, was more accurate than John, kind of ideas. Okay. So again, going back to those three key ideas is one of the main focuses of a facilitator is to encourage participation. Okay, this can do with quick check-ins, so check comfort levels. When you notice someone who is feeling agitated, who is using those defense mechanisms, checking in with them, making sure they're okay, making sure everyone is comfortable with where we are in the group setting. um, uh, uh, One teaching technique that they try to teach you, and I don't I think maybe I need to do a better job of this, is if you've ever been in a class and the teacher kind of in the middle of a lecture asks a question, and wants produced answer. What they're doing in that situation is doing a quick check for learning to see if everyone in the room is kind of getting that idea. That's something similar that we do in the group setting. But in the group setting, we need to check on people's comfort level as well. How are they doing emotionally? How are they feeling? Okay. Very common addiction groups start this way. They'll come in and say, what are your core feelings or emotions today? and they may go through your cognitive, behavior, social, and emotional areas. So cognitively, I had a lot of negative thoughts today. Socially, I was grumpy and offish with my partner this morning, and then emotional, I'm feeling frustrated. And they'll go through and discuss those, and I put them all in a negative light, but sometimes they're very positive. But that's kind of that checking for the comfort level, making sure everybody is here and present. Allow all ideas to be heard, um, make members feel good about their contribution. A lot of times, there's some very heavy things that are going on in the group setting, and it's easy to just empathize with someone and go, geez, I really feel for you, and I'm feeling your pain and what you're going through, but always ending with something like, and I truly appreciate you for making the decision to speak up about what you're experiencing. So just always ending with that positive kind of thank you for contributing, thank you for bringing your thoughts and feelings up. Ideas and decisions should be group nominated. And so this really comes to the idea of, so let's say you taught a coping skill. You kind of check in with the group and say, who feels like this coping skill could be effective in your life? And if you get the whole group going, yeah, I think I can, or at least moderately leveled, you're in the right path, because then you can start the role play process. But if the majority of the group is kind of like, no, we don't get that, we should try something else, as the facilitator, you really should consider either finding a different way to re-explain that skill, or going on to the next and maybe consider coming back to that one at a later time. Because the last thing that you really want to do is say, okay, I understand you guys are not comfortable with this skill, but we're going to role play it anyways. I promise you, you will have group members that will not show up the next week. The last one is being supportive, and that's making sure that even on the hardest days, you make sure that um, your group member or group members feel supported. But the very common thing that is missed in the group process is the individuals who seem to be going through the most negative experiences tend to get the most support from the facilitator. And this is something important to keep in mind, is that it's important to give equal support to the individuals who had a wonderful week, who are uh, who say positive things about they implemented this coping strategy and it worked really well. Making sure you provide equal amount of support to those individuals is as important as providing support for those who are struggling. And I'll tell you why. Group members often look at the facilitator as the person that I should model. I should really see and look at and say, wow, this is how this person, this is how we should be interacting. Okay. If those who are struggling in the group don't see you providing that attention to those who are successful, you're giving no reason for those who are struggling to get out of their struggle, because they're getting all the attention. So it's kind of this role modeling idea plus encouragement to continue a person's success, to make sure you give equal support to those who are really being successful through the treatment process and those who are struggling. Because providing that gives the reason for those who are struggling to keep trying and to keep going. So, why do we need facilitation skills? Like I mentioned, this idea of role modeling. Okay. While the facilitation skills help us so that we have good planning, that our groups are organized, and they keep members involved, as we just discussed. You also have the ability to role model leadership skills and then encourage other group members to take on those skills. Uh, it's easier with good facilitation skills to increase individual skills and coping skills. You role model good communication, and you also role model uh, resolving conflict in all of the conditions that we've talked about, from addiction, mental health, to trauma, to loss. Good communication, learning good communication and resolving conflicts are just as important for many individuals who are suffering from any of those conditions to learn and to practice just as much, if not as increasing their skills, increasing their coping abilities, in relapse prevention, giving skills to um, avoid a relapse or to deal with cravings. Teaching these skills are just as important, and that's one of the benefits of a good group process. So I would, definitely say the most important things that a facilitator can do is promote these three things. Okay. So, what does being a good facilitator really include? And um, we'll kind of conclude with these remarks so that you have time to go look at that and write down any questions, the assignment, and write down any questions. Um, Being a good facilitator means you know the end goal. You have a picture in your head of what you think a group member should leave the group like. So they should be able to speak up and self-advocate, for example. They should be able to reduce conflict, going back to those three things we just dealt with. They should have effective coping skills and ability to work on their symptoms, quote unquote. Okay. Um, and so those goals then get broken down to the weekly group and what skill you're going to teach that week, how you're going to facilitate it, how you're going to role play it, all of those things. Keep the group and the agenda moving forward. Um, and this can be a challenge at times because each group you facilitate will be very different from the last one. I say this in higher education. I've been teaching classes like this and Psych 101 and a lot of the psychology classes for 15 years now. But I can say that I've never taught the same class twice. There's always something different. Um, and this is something to keep in mind because each group comes with their own benefits and their own challenges. Okay. A good facilitator involves everyone and doesn't exclude anyone. And finally, they try to make it so decisions are made democratically. Okay. Now, this can be in some cases challenging. For example, if you're doing a treatment group inpatient, where some of the rights of participants can be limited, I should put it that way, such as phone time, such as ability to communicate with others outside of the treatment bubble. all of those things. So, for the most part, those decisions that can be made democratically based on the population that you're working with should be a part of your facilitation skills. Okay. All right. So on Thursday, what I hope to do after we go through any Q&As on the assignment is we're going to start with the planning process for a good group process and what should that look like when we're planning just a complete group, but also planning each session that we have with the group members. And that's where we will start this coming Thursday. But I am going to stop here. I'm going to stop